more distance is better than less, simply, right? If I cough or sneeze, large droplets will settle out quickly, usually within 6 feet or a couple meters, but some will stay aloft. A really powerful cough can project 25 feet through the air. So you want to maintain as much distancing as you can. We're at the point, universal mask wearing is a good idea. In places like an elevator, absolutely, where it's hard to control these kind of exposures. Even simple things, though, like aligning desks so they're off center. So if you and I are talking or we're working at a desk and I cough, it's not going right into you, right? It's a little offset. Those things matter for spacing. Some of the basics around a plexiglass shields can be effective as a physical barrier. And then, of course, what the air handling system is doing. And it's that idea, if we layer enough of these controls in place, including screening controls, stay home if you're sick, self-attestation in the morning that you don't have symptoms. That's the before coming to work control strategy. Then at work, you layer these defenses in place. They can be quite effective. Knowing that no one strategy alone is sufficient. It reminds me of what we do for physical security, right? We just layer on defense after defense after defense, and you can significantly reduce risk that way, but no one thing by itself is enough.
What would you recommend people on the WebEx do in terms of benchmarking their efforts? Is there any benchmark data that talks about COVID compliance and think about using some of the technologies that can help?
Yeah, I think this is the next level where a lot of organizations have got their return to building plans in place. Fewer have the strategy for how you're going to verify performance, which I think gets to your point about benchmarking. How would you know it's working and what are you comparing to? And so in the book, we talk about these health performance indicators. And let's take carbon dioxide, for example, as a proxy or an indicator of ventilation. Well, we know what level you should be targeting. And for many of these other hazards in the indoor environment, we have targets that are occupational limits, we have screening-based targets, we have hazard-based limits, and we also have optimal targets. Very often we set these standards in buildings that are really set to, to prevent the worst of the worst adverse outcome. But we also want to create indoor environments that target optimal human performance, not just disease avoidance, but health promotion. And those targets aren't as clearly published. We know what they are in the scientific, it's in the scientific papers. But if you look at hazard numbers, those are out there. What level of formaldehyde is toxic? We know that. Well, what level of ventilation is health promoting? And here you have to read into the science a bit more. We have a chapter in the book called The 9 Foundations of a Healthy Building. We talk about things like ventilation. We give some of the science, and then we give recommendations for those kind of health promoting targets or indicators that people should try to achieve in their buildings.